When individuals started hearing about our Behavioral Health Academy, they started really getting interested in the fact that it views everybody with a co-occurring lens, and the fact that individuals can come in and get treatment holistically and simplistically. And so they wanted to become part of it. The real impetus for why we created the Behavioral Health Academy was simply a realization on our part that we had a workforce shortage problem. We, in particular, had a shortage of providers who could do substance use disorder treatment. And as we started really digging into that deeper, we started to notice that the way we delivered care probably wasn't the most effective or efficient either. If you had both a mental health and a substance use disorder, we would first ask you, which one do you want to work on first? Because most of our providers could either do behavioral health therapy or they could do substance use disorder therapy. And so we felt like we had to start developing people who could do both the substance use disorder treatment and the behavioral health therapies at the same time to not only be effective, but to quite honestly be efficient in the care we delivered.
For the student, I think it provides you with a level of experience in a short amount of time that you can't necessarily get other places. And then from the provider end, I think the Academy prepares potential therapists to be better prepared almost immediately once they go into the field.
We've already seen that the interns going through our academy and the interns who have graduated from our academy that we've hired feel far more confident working with individuals when they come in with co-occurring disorder. They don't question their skills or their ability. They know that they've had both the in-classroom training plus the practical hands-on experience through our internship process to be able to effectively treat these individuals.
I would absolutely recommend this program. When we came together for our classes, we were able to kind of share our different experiences.
And it's also created a lot more awareness across our whole workforce that this is a concern that deserves to be treated. It's not a moral failing, and that every individual is deserving of care. And quite honestly, it's reduced stigma network-wide as it relates to behavioral health and substance use disorder.